3 simple questions. Number 1, how many people here have cancer? Don't raise your hand yet. Number 2, how many people here have cancer but you're in remission? And number 3, how many people here have a loved one, a family member, a close family member that has cancer? If you're in one of those 3 people, let me see your hands. Thank you. Statistically speaking, they say 1 in 2 men will have cancer in his lifetime. 1 in 3 women will have cancer in her lifetime. And this thing is epidemic. So I'm going to give my testimony later, but what I want to do is I want to set up what a typical day is like when we go to the clinic.
Wow, this is the first room I was ever in.
It's your old room.
I know, it's from where I first started.
Yeah, very good.
Everybody say hi to Catherine.
Hi.
This is the part I don't watch.
Watching is not a requirement.
Oh, it's down. 106.63, but then again, I just gave blood, so.
Good vitals. I like it. Thank you.
Thank you.
All right, Dr. Lee, in a few minutes.
Lights.
Yes.
He just hangs out like that. Introducing Dr. Nezami.
Thank you. And I'm introducing you guys to something that I would be honored to present tonight, that I think it's a mind-blowing revolution. And it has several aspects from the scientific perspective as well as a spiritual perspective, because when I treat my patients, I don't only treat their body, but I also treat their soul. And as a physician, it's hard to claim that because I'm not a pastor and I haven't gone to schools to know how that part of the religious part of it works. But I can tell you that I've been very interested in the spiritual aspect of my treatment and the healing of the spirit. And sometimes other physicians ask me if I could teach them how to treat the patients the same that I do. And I always tell them that it's not just the art of medicine and the science and basically the material part of it, but also it's the part of the healing that comes from the heart. And that's the part that I think is the most important part when, as a patient with cancer, especially because it's a devastating disease and whoever is dealing with it obviously is going through a lot of stress. When you go to see your oncologist, you need to care the most about is that how much can you really spiritually connect with your healer and with your physician, because if that physician puts you as a patient in his or her priorities and as important as his or her own family, which I think is what I did, and that's the key of my success partially, you're in good hands, because that starts the caring part. It starts the whole process of healing. And it's a teamwork between the physician and the patient to get better. And unless the physician has committed enough spiritually to heal you, it's always a matter of physics and material, which sometimes does not even explain the miraculous results that I see in my clinic. So when I teach other oncologists and when I teach other physicians, that part, it has to be there. Otherwise, whatever we do as physicians to heal the patient or treat the patient, unless that part, the spiritual healing, the spiritual caring from the physician is not there, usually the treatment fails. All right, so I'm going to talk tonight about who I am and how I got to where I am and what sort of services I provide. And the purpose of this talk, especially in the settings that we have as a church, is really not to sell anything. It's not to market anything. I have patience enough that I don't need to do this. But rather it is to bring a new message, because unfortunately, as Joe mentioned, we have a disaster healthcare system that I'm sure you guys mostly agree with me that has failed in a variety of reasons when it comes to devastating situations such as cancer and many other chronic conditions. And the reason that it has failed is because many companies that have invested a lot of money into the cancer and the drugs for the cancer, the only way that they can make their venture profitable is to make the drugs very expensive. And in fact, the more drugs that they sell, the more treatments that they sell to a patient, it makes it more profitable. So the intention of coming up with a new drug in the market not necessarily is to defeat the disease. Rather, it is to continue treating it with newer and newer drugs. And it's one of those wars that if we don't win, we make more money out of it. So it's not in the best interest of some pharmaceutical companies and political institutions to really win this battle, rather continue it as the weapons of the war, which are the drugs, are more sold. So when I started medicine, first of all, I had this intention of going after challenges. And I always wanted to be one of those people that have invented or innovated a new treatment for something that is incurable. And that's why I chose oncology, because cancer, because I knew that, as we all agree, there is no actual cure for many types of cancer. In fact, the conventional medicine has only provided about 4% cure. So that was very interesting to me. And then I was very good when I was this little kid in the school at math and geometry and physics and algebra, all those things that has nothing to do with biology and medicine. And so when I decided to choose my major and go after it, medicine was the last thing I could think of, because I was terrible in biology. I could never remember anything, but I could make sense and common sense and logics from everything. So, but the sad part, I should say sad, but the interesting part was that even my physics teacher was telling me, you're going to be a doctor, right? Because I was so good. And so when I became a doctor, I started to use my logics. I started to use the part of my brain that was telling me what is really making sense and what is right, what is the missing part. And yet, as we speak, when I see a patient, I try to analyze the genomics of the tumor and start to create a treatment plan that is based on individual genomic markup of the tumor and the patient. And that is what we see recently as a trend in oncology and research, because now we know that blindly treating a patient with cancer is always a failure. So I'll give you an example. I mean, many of you, when Joe asked if you know somebody with cancer or you already have been dealing with cancer, you raised your hand. And so if you, let's say, have 10 women in this room that have or had cancer, breast cancer, for example, if you go to their oncologist, they will always get the same drugs, because current standard of care is that they treat the cancer based on its type, not based on its genomics. So if you have breast cancer, book says this is your treatment. If you have lung cancer, this is your treatment. And so that was why I decided to try to change this dynamics, because it really did not make sense. Every cancer has a different genomics and needs to be treated differently, and it deserves a customized treatment. When I started this thought process of treating every cancer individually, nobody was talking about it. Recently, in the last 5 years, individuals who are doing a lot of phenomenal research in the laboratory, they have started to recruit engineers, because they know that, for example, Harvard Stem Cell Research Department has worked with MIT, because they know that to be able to assemble a treatment that works as specific genes at the DNA, you need physics and you need math to assemble those drugs based on those targets. It's not something that biologists can do. So I started to use that part of my brain. And again, back to what my intention was, which was to help the patient always as a priority. Even when it comes to my family, I always put the patient ahead of my own family. I guess that speaks when I'm here on Friday nights at 9 o'clock, 8 o'clock at night. That just tells you that I care about the patients more than anything else in my life. When you put that caring part with a good systemic an analytic brain that is using logics on assembling new treatments, then it's a great combination, because you have somebody who cares, a physician who cares, and now the knowledge comes to play. And these two parts, when you mix them together, somebody who cares and has the knowledge, then it creates miracles. And that's exactly what happened to me, was that about 10 years ago, I was treating patients with cancer, and I had basically dealt with patients who had no other hope. They had 2 weeks to 2 months to live. Everything else had failed for them. They had been discharged by their oncologist, told them to go home and die. There's nothing we can do for you. And all of a sudden, this doctor comes who has much less experience or training in the field, but has the logics and the caring part, and starts to create something that turns 10 years later to a novel treatment for cancer as we speak. So that's a little bit of background of where I came from and how this happened. Many of those patients, as we speak, they had miraculous results. We started to look into why this happened because I couldn't explain what I did that this happened. So it was the divine intervention, and I think that's why I'm here, because the divine intervention and the God's mercy and His compassion was what made me to be able to be successfully able to treat these patients. And you see now I'm speaking in a church. So now it makes sense after 10 years how the whole thing planned out. Let's go to the slides because we're going to run out of time. So I called it MTET protocol after many, many years of studying of my own treatment because I didn't know what happened. So I had to go back to the laboratory, do a lot of studies. I partnered with many academia and major institutions in oncology. The seminars that 10 years ago I was not even able to attend, now I am the organizing committee member. Now I review the journals or abstracts in the journals before they're published because I'm in the peer reviews, and I basically choose who to speak and who not when I didn't even have a chance to attend these seminars 10 years ago. So all of a sudden I call it again divine intervention. God came to play a big element in this journey by showing me the way and opening the journey for me to be able to be where I am now. So we called it MTET protocol, or multi-targeted epigenetic therapy. Thank you. Sure. Thank you. MTET protocol stands for multi-targeted epigenetic therapy. I don't want to make the scientific part of the treatment very complicated for you, but I usually use examples that make it easy for the common man to understand it and why this works. This is our website. If you guys want to write it down or somehow keep it, because after the talk I may not have enough time to answer all the questions, so you can go to the website. It's called allcancercare.com, and it has testimonials, it has my biography, it has many, many information that you may find useful. If you had any questions, obviously there is a contact icon, you can click on it, and all the questions comes to my personal email. Next, please. Okay, so let's go back first. Okay, I talked about, God is always in charge. Have faith and seek healing from Him, and I will always help you. Patients come to see me, and they always say, God, you are my Savior. You saved my... And I say, don't talk like that. I am nobody. I have not saved a single person in my life. Everybody that I have saved, or they think I have saved them, everybody that it looks like I've saved them, God has saved them. I am just a tool. And so I have a great team of scientists. I have, as I said, many, many professionals in my board that we work very closely together. I run many corporations and institutions that are all doing research in cancer now. So if anybody is interested, or even an oncologist is interested, I can just show them what the significant work we've done in the past few years. It's just unbelievable. Just today I was talking with one of my scientists in New York, and I work all across the world with scientists, and we're paying them to do all this research. All the money that we are spending to do the research comes from the patients. Isn't that amazing? I have not charged a single penny from insurance companies. I have never received any grants from government or any places. Patients that I have treated, they have sponsored all the research that I have done. They have sponsored everything that we do. And it's amazing because these people, if they didn't have good results, obviously, I couldn't have a business, right? How many people can you lie to? So at the end of the day, my practice was based on outcome. So I told myself, I said, If I accept insurance, insurance is going to pay me anyways. If the patient dies or if the patient is cured, I get the same amount of money. So there is no incentive for me as an oncologist or a cancer care specialist to save somebody's life, at least financially, right? So I said, I'm going to refuse to receive any money from government agencies and insurance companies just because I want the patient to pay for their treatment if it works. If it doesn't work, obviously they're not going to pay me. So that makes another incentive for me to be able to prove that my treatment works. Thank you. Thank you. Thank you. And now as we speak, we are establishing a nonprofit organization which hopefully very soon will make my dream come true, which at one point no patient should even think about money or pay for their treatment, because the nonprofit should sponsor the people who don't have cancer, the people who are healthy, as part of their, I think, religious duty, is to sponsor the patients who are dying, sponsor the patients for the treatments that can save their life. And that's what my goal is. My goal is to open the doors at one point to all the patients, hopefully soon, and tell them, you don't have to worry about money, you don't have to pay for your treatment, you all come here and get treatment and healing. You know, isn't that great? Wouldn't that be great? Yeah. So, my interests are in several different, oncology-related scientific subjects, as immune therapy, genetic and epigenetics, metabolic treatments of cancer, and managing the stroma. Some of the slides are technical, and it's okay if you guys have any questions technically, you can ask me later, but these are mostly the subjects that we are interested in as far as the research goes. I have an advisory board, and I have many people that, from regulatory side to scientific side to financial side, they team up together once a month, and we talk about the subjects and the projects. Usually with these slides, I try to clarify some misconceptions that are out there about integrative oncology and integrative medicine in general. Back in days, I would say maybe 15 years ago when I used to teach, if I had a student who asked me about any sort of natural therapy, I would have told them, don't even think about it. You know, whatever plant cures cancer, or whatever fruit you take it and it cures this and that. And I was a very hardcore doctor. And from that to what I'm doing now, using natural compounds to treat cancer, is a big revolution. And what happened was not that I didn't like drugs. I didn't like natural compounds. But the reality was that because I cared for the patient, I got tired of giving them drugs and having no results. So I said to myself, well, what if we look at natural compounds as sort of new drugs? And what if we treat them, give them a chance as if they're new drugs? So, you know, when you're using a plant, we don't even call it a plant, we call it a new drug. How's that? I started to investigate them, and the only reason that I was able to convince myself to use natural compounds was the fact that they worked. And again, going back to the same thing that I said, divine intervention. God opened the door and my vision to something that I didn't even believe in. And that created the entire MTET protocol and entire project, because we used natural compound and they worked and they proved to be effective. It's interesting if I tell you, when I started to work with many of these laboratories, they didn't want to study any natural compounds, and I knew that. So I was labeling these natural compounds in the vials under different names. So they didn't even know that these are natural compounds. And we called it new drugs. And we sent it to them, and they were super excited to see these miracles drugs are how they're working. And they were calling me and telling me, your drug, it's not my drug, it's a plant that God has created. Your drug is gonna be the future of cancer. Yeah, it's not the future, it's the past. It's been around for tens of thousands of years. Okay, so customized targeted therapies, the effect of chemotherapy, my protocol case studies. So I'll try to go over these very quickly so we don't run out of time. This is conventional oncology, thinking inside the box. Everything is inside the box. They don't deal with anything outside the box. That's why they have 4% success when it comes to cancer. Now, epigenetics. So the science of now I'm going to talk a little bit about scientific part. What is epigenetics? Epigenetics term came in 1940s, long time. Actually, before that, the epigene was first time described by Apostle, and it was a spiritual terminology. When genes could not explain the phenotype, meaning that your genes could not explain what happens. The material could not explain the effect. They thought it's energy because you don't see energy, but you see material, you see genes. So they called this energy epigene, or above the gene. What do we call God? Above material. And that's exactly what they called this epigene or above gene effect back then in apostle times. Meaning that we don't see it because it's not in the gene. We don't see it. But it rules over the genes. It rules over material. Later on, we had scientists like Einstein who said that energy turns into material and material turns to energy. Now we have a little bit of better understanding of what that means. But again, we don't see it. But it's a powerful element. Now, it is hereditary, meaning that genes transpass from one generation to the other generation. Epigenes, we don't see it. But this energy also transfers from one generation to the next. As if we are talking about karma. As if we're talking about the deeds, your behavior, that may not necessarily affect you, but it will affect your children. Many patients that I see these days, they are diagnosed with cancer that is only caused by smoking. Meaning that if they are not a smoker, they should not get this type of cancer. When I ask them, they've never touched cigarettes or any other smoking. So how can you explain somebody with smoking-caused cancer that has never been exposed even passively to smoking? The only explanation is that somebody in their parents was exposed and did the smoking. And that's always true. When I ask them, how about your parents? They say, yeah, my dad smoked heavily. And that's why you got cancer. You pay or are punished the price for what your parents did. That's epigene. So it's hereditary. So that part it shares with genes because genes are hereditary too. What it doesn't share is that genes are not changeable. Meaning that it's like this, we look at the DNA, it's like stuck in my neck. You can't get rid of it. You're born with it and you're gonna die with it and you're stuck with it. But epigenes are reversible. Meaning that if you do something right, you can clear what your parents did wrong. We're getting closer and closer to the spiritual part of the whole thing, right? That's why I'm in the church. Because realistically, our therapy does that. Our therapy goes back to the gene and epigene, reverses your parents' smoking effect on your gene. Pretty amazing. Okay, so it changes the whole concept of heredity. So it's a non-DNA variations can be transmitted in the cell and organismal lineage, and challenges the widely accepted Darwinian concept that you are born with these genes, and based on the Darwin's theory, you are going to have these genes translated to your next generation. It changes that. Again, that's why I'm in the church, right? It's a very philosophical talk. Okay, so again, going back to the DNA, and I don't know how much you are interested to learn about the DNA. So you see on the DNA we have heterochromatin, and this heterochromatin is made of these compact pairs of the base pairs, what we call, and the nucleotides. And this is not bad actually type. So when you look at this type, you imagine that these are genes that cause cancer, the black lines. You have some white lines there that are surrounding these oncogenes or the cancer genes. These white parts are oncosuppressor genes. These are the genes that suppress the bad genes. So these are good genes. That's why not everybody gets cancer. And now I tell you why now we have epidemics of cancer, because these oncosuppressor genes, the genes that are supposed to suppress the bad genes and these prevent cancer, they stop working. They stop functioning. So the bad genes, oncopromoter genes, now can express themselves and create the disease. The heterochromatin, this chromatin, becomes compacted like that. And although the DNA markup or the genetic markup of the DNA has not changed, but the shape of it has. And the shape of the DNA can be reversed. Meaning that if these cause cancer by a compacted chromatin that is transcriptionally silent for the oncosuppressors, when the patient is exposed to my treatment, again, the treatment that God has given me, this happens. So the DNA goes back to the normal function as if this insult never happened. The oncosuppressor genes start to become active again, and your own DNA stops the cancer genes from expressing. So it's a fascinating science. We didn't know anything about what I just told you back in 2010. So everything is from then beyond. And I remember the first time that I went to MIT and met with all those scientists in 2011, everybody was scratching their head that what is going on? We have no idea. Now we have a little bit of better understanding. Many questions are still unanswered. But this is the concept. So we have chromatin, the DNA associated with histone proteins, transcriptionally permissive chromatin is like this, transcribes, is open, and then we have transcriptionally repressive chromatin that is closed. So this is heterochromatin or transcriptionally silent, so the oncosuppressor genes cannot function. Now, the interaction of the genes and environment is what makes the whole science of epigenes. So just like I said, this happens if me or my parents have been exposed to something in the environment that caused this. So it comes from environment. And this environmental exposure, for example, could be smoking or anything else. And I got this question early on that why do we have all this cancer these days, right? Because our environment has changed. Because our environment now is making the DNA like that, or the environment that our parents lived in did that, so that we inherited the gene that was transcriptionally silent. And if you agree with me, many regulations as far as environmental regulations and policies were not in effect back in our parents' time. So there were a lot of exposures back then to pesticides, DDT, all these things that could cause this. And they didn't get cancer necessarily, but their kids, which are our generation, are all affected. And the other main cause of seeing all these cancers in our generation is the drugs. So you're taking a blood pressure pill, it's carcinogen. I can show you studies that show that many of categories of blood pressure pills cause cancer. You're taking a diabetic pill, cause cancer. You taking many pills that are in conventional style, antidepressant, cause cancer. So drugs are also very important. Now, if you look at, I'm sure you've heard about the BRCA gene, Angelina Jolie, the whole story. So back in days, in 1940s, when we started to understand about BRCA gene, the people who had mutated BRCA or defective BRCA is one of these, by the way. These people had only a few percentage chance of cancer if they were BRCA positive. So if you look at 1940, they only had 24% chance of breast cancer if they were BRCA positive. Now that is 67% after that. So 24% to 67% is the fact of this environmental exposure that causes the BRCA other allele or SNP to also be methylated. So you have a mutated BRCA and a methylated BRCA, so you get double hit and you get cancer. So environmental exposure and the genetic susceptibility, if it comes together, end result is cancer. So you have some genes, everybody has cancer genes, but they don't necessarily get cancer unless that environmental exposure completes the vicious cycle. Does that make sense? Yep. Okay, good. All right. This is the science of epigenes. Caterpillar and butterfly, they have exactly the same genes. But the genes are shut off and on by the whole epigenes. So the DNA of the caterpillar is like this, and the DNA of the butterfly is like this. It's the same DNA, it's the same gene markup, but it expresses differently. So it changes the phenotype. If this is Joe before my treatment, this is Joe after my treatment. Thank you. So we switch the genes on and off, so we express the genes that are good, and the cancer goes away all of a sudden. They have done studies on different types of mice. For example, these are twins, by the way. Twins, identical twins, should look the same, right? But this identical twin looks different than this one because they had different environmental exposure. These also are epigenetic modifications of the mother mice that was exposed to different diet. And you see that when the mice is fed with a diet that has these sort of supplements, all natural, the mice becomes healthy. This one is healthy, the other one is obese. So you see the diet during the pregnancy determined the destiny, the fate or the destination of the genes in the offspring. Why do we get cancer? I don't want to get you very confused, but as all we know, cancer is produced by the mother cell or stem cell, and these stem cells are committing themselves into different lineages and producing cancer by the same concept of what I told you, epigenome, and what I showed you. We have good stem cells that are needed for physiological growth and development, and we have bad stem cells that are cancer stem cells that are uncontrolled, and they continue repairing and producing new cells. So the concept of my treatment is that it goes after the mother cells. It goes after the stem cells, and it differentiates them. As if you have a bad child and your bad child is misbehaving, you don't kill your child, right? That's what chemotherapy does, right? You have cancer, we're going to kill it. No, you're not going to kill it. You're just going to modify the genes, because if you bombard the entire Middle East, the terrorists will still come. You have to go after their leaders, which is the stem cells. And you have to differentiate them. How's that? You convert all the terrorists, we don't have terrorists anymore, right? So you differentiate them, as you see here, like normal stem cells, cancer stem cells can show plasticity for differentiation. They can become normal. So these are bad children that are misbehaving. Instead of punishing them and throwing them in jail, you can teach them and educate them so that they will become good children. And that's exactly what my treatment does. Reverses the insult and exposure that happened sometime during your life or your parents. All right. So we have about 282,000 mutations types that has been recognized. And this data is a few years old. And back then, we had only 14 drugs that were commercially available for 282,000 targets. So as time passes, this becomes a big money maker for the pharma to make drugs every day for these targets. But unless you go after the mother cells or cancer stem cells, whatever you do on the tumor cells, it's not going to work, because the mother cells are there, and as soon as you kill the working bees, the queens are going to reproduce them, and you're going to deal with cancer again and again and again. So MTET has synergistic effects with all conventional treatments. In other words, conventional treatments won't work unless it's combined with epigenetic modification in most of the cases. This is a slide. I really like you to pay attention to this, because it sort of shows how synergistically my treatment is with chemotherapy. This is chemotherapy, the second bar, and this is my treatment. The effects. Unbelievable. Thank you. Thank you. Thank you. Now, again, when I send the materials to this lab to do this study, I didn't tell them these are coming from licorice and plants and all that. I told them these are new chemotherapy drugs that I have invented. And the guy called me from the lab and he said, I have never seen this. What the hell are you using? And I swear to God. So I see that on my practice too. I mean, most of the patients come, and this was a lady with a stage 4 breast cancer I treated in a matter of 2 weeks. She completely recovered. The cancer went away. The circulatory tumor cells completely went away. Yeah, so, the dates, it's 2011, if you look at up there. In April, she had 24 cancer cells in the blood in every 7.5 cc. She had less than 4 months to live. And 3 weeks later, it became to 0, nothing. And this is another patient with breast cancer. You see the scan here. Everywhere, all these bones, you see the dark is cancer. Everything dark is cancer except the bladder, urine, and brain. Pre-treatment, post-treatment. All these bone lesions, you see every bone is involved. Completely gone. This is 6 weeks later. And no cytotoxic chemotherapy was used. This is a lady with melanoma, and this is melanoma everywhere before treatment. 2 weeks later, cleared up. Breast cancer again. She came after 5 days of treatment and said, Doctor, my cancer went away. And I said, yeah, I know, come on. And because patients really believe in me like I'm God. And I told them, I said, maybe she is just thinking that her cancer. And she said, no, see it. And I touched it and I couldn't find anything. And I said, maybe I can't, because she had a big mass. I said, maybe I can't find it. Maybe if I send her to a scan, they can find it. Maybe it's inside now. Sure enough, everything went away, including my slides. Yeah, so it was almost, so thank you. All right, I'll take 10, 15 minutes for questions, please.
Thank you for your talk. My name is Tom Baden. I'm a family practice physician, and thank you for your great talk. Can you talk about the FDA, how drugs are approved and what needs to be done for you to get FDA approval?
Very good question. So I went to FDA. There was a workshop a few years ago because I was planning to get the drugs approved to the FDA. There are a couple of problems with that, obviously, as you know, is that if you go there as a family physician, doctor, an oncologist, as a physician, obviously they don't even recognize you. So you need to have a pharmaceutical company. We said, okay, we're going to build a pharmaceutical company and start doing what they're doing. We built a pharmaceutical company. So I went there and I said, well, let's see what's going on. The director of the drug division was there, and I shared some information with him. He was very interested. And during the workshop, they started to talk about how religiously FDA is trying to make sure that every drug that comes to the market is safe and effective. That's the role of FDA, correct? And when they were so much insisting on this part, it was just a few days after FDA approved a drug for a stage 4 colorectal cancer that had only 0.4% efficacy and the toxicity of 40%, life-threatening toxicity. And so I raised my hand and I said, I have a question. You're talking about the role of FDA and how proud you are. They come with all the medals like generals about the fact that you're controlling, making sure that no toxic drug comes to the market and make sure that all the drugs are effective. How do you explain Estivarga was the name of the drug that is approved a few days ago with 0. Like you have to have not 100 patients, because if you have 100 patients that you treat, nobody responds. You have to have 1,000 patients to have 4 patients responding. And the response was only better, 0.2% from placebo, yet 40% toxicity. And beyond that, so even if you had 4 patients who responded in 1,000 patients, and you would have cured them, I would have still given it a chance. Maybe you're one of those 4 out of 1,000. But the response was defined by 9 additional days to live. That was called a response. And so I asked him, I said, I want an explanation. And you know what he said? He said, I tell my folks all the time not to approve these toxic placebos. He said that himself. I never had this. That the FDA calls the drugs that they approve toxic placebos, meaning that you're taking a sugar pill that's going to kill you. So if you recall, back in 2005, FDA came after approving Avastin for breast cancer. So many people died of the drug that they came and pulled it out of the market themselves because of this toxicity that was life-threatening. Yet, Abbott, that is the company that is making the drug, is selling the drug as we speak with a profit of $16.8 million per day. $6.8 billion a year. The drug that was pulled out of the market for breast cancer in 2005 by FDA. So you see that there's a lot of problem going on. Now, with that said, I still am interested to know, because I work with National Cancer Institute very closely. In fact, they invited me to put up a workshop and invite FDA to come there so I can teach them what's going on. But at the end of the day, if I say that I have something that cures cancer, for example, or has significant responses, if it becomes a competition for big pharma, you're not going to see me again. So that's why when I tested all these compounds, I tried to say this synergistically works with other compounds so we won't create competition and resistance. The revolution comes from you, comes from people, comes from patients and their families. It will never come from government. And I can tell you, I treat government agency people, including FDA, that their kids have cancer, and they don't want anybody else to know that they come to see me. Any other question?
I talked to you earlier about the causes of cancer. You mentioned environment. Is there a way we can reduce our risk? Like I speculated, is it
Right.
in the foods, the chemtrails,
Exactly.
cell
So-
phones, microwaves,
It's right here.
the plastic in bottled water?
Of course. So plastic is a big one, as I said. But I believe that most of the exposure has happened to our parents, especially because they were exposed. And it's not going to end in us. Unfortunately, our kids and our kids' will be also affected by the exposures that, for example, our parents had back in days to many of the environmental pollutants. But we still have a lot of those environmental pollutants still in the environment, and nobody talks about it. So again, that's a big one. On a daily basis, if you have family history of cancer, if somebody has had cancer in the family, they can call my office, I can come to the clinic, and I can run tests for them so I can identify the genes that could potentially cause cancer in them and prevent that. So Angelina Jolie's story is a big one, for example. She had BRCA mutation. She took off she resected all her ovaries and breasts. She shouldn't do that. With my treatment, easily, you can avoid, because BRCA has a gene on top of it, it's called P10. When the BRCA is not working, all you have to do is to augment the P10. And it takes over the BRCA and it repairs the DNA. So with the protocol that I have, includes 4 natural products, you can augment the P10 and you never have to remove your breast and ovaries.
You mentioned supplements. Is that supplements we can take, or is that supplements that we take that'll benefit our children?
It does both.
Both.
Whatever you do in your life, from a good thought and a good deed to the supplements that you take, will affect your children. I can't hear you.
My daughter has, oh boy. My daughter has a BRCA2 gene.
Yeah.
So are you saying that she can come and see you and get,
Of course. She should come and see me.
and you can reverse having the BRCA2 gene?
You have to speak louder.
You can reverse the BRCA2 gene effect.
No, so BRCA gene, as I said, when it's mutated,
Yeah.
it doesn't mean necessarily that you will get cancer.
Right.
Unless the other allele is methylated. So there is a part that is environmentally determined. And that part can be reversible. And
So
yes,
you have to wait till you have cancer.
No.
Right.
So we reverse the environmental part of it, even if the gene is defected,
Right.
so that it cannot express itself.
Okay.
Or it can express itself in this situation. Yes.
Would you be able to treat like the lung mutation, EGFR? My husband has.
Go ahead.
Do you treat the lung mutation,
EGFR mutated lung cancer you're talking about, non-small cell lung cancer?
Yes.
Yeah, definitely. I will treat that very, very successfully. And again, I don't treat it. Divine interval, whatever you want to name it. We have found a way to treat EGFR mutated lung cancer very effectively these days. We combine the targeted therapies, scarlatinib or tarcibol, with our therapy that basically open the EGFR and makes it vulnerable for the drug. So traditionally speaking, somebody, you said your husband, somebody like your husband who has this sort of mutation caused lung cancer, they only respond to the drug that's commercially available, EGFR blockade, for up to 12 months. So if they take the drug, it blocks the pathway, they leave additional for 12 months. After 12 months, it doesn't work, right? Or you have to change it to the T790M mutation. Yeah, but it stops after 12 months. Our therapy makes the drug effective to our knowledge, because that's, we're going back to the number of the patients that I have treated back when this knowledge came across, indefinitely, meaning that you can stretch the response, as far as we know, indefinitely. Now, it might be 5 years from now that I change my mind because some patient after 5 years had resisted. But so far, we are extremely happy about the results because these patients do much better with the combination therapy.
It sounds like there's a lot of different kinds of cancer that this method is effective with. Can you talk about how many different kinds of cancer, or
Right,
are there
so-
any that is not effective with?
Good question. So back in days, we, even as we speak, unfortunately, conventional establishment of oncology is used to treat patients based on the type of the cancer. Just like I say, if you have breast cancer, this is your treatment. Lung cancer, this is your treatment. Now, I don't do that. So it's not the type of the cancer that determines the response to any drug, because all these cancers are coming from bone marrow stem cells. The stem cells that go from the bone marrow to different organs, they cause cancer. So the same stem cell goes to the lung, causes lung cancer, goes to the pancreas, it causes pancreatic cancer, it goes to the breast, it causes breast cancer. So instead of treating these daughter cells that we see in the breast and we say, oh, this is breast cancer, you have to go after the mother cell that comes from the bone marrow in all types of cancer. So that's why our therapy is effective regardless of where the location of the tumor is, because their mother is coming from the same place.
Hi, I'm Tina, and I'm currently battling cancer successfully, and so are some of my family members. We're being treated at the Hoxie Biomedical Center in Tijuana, Mexico. And we learned that our cancer, even though we have different types of cancer, was most likely caused by GMO foods. How do you feel about GMO foods?
Yeah, how do I feel about GMO food? I don't like it. Well, as far as, everything I say has to be professionally examined before it comes out of my mouth. So if I tell you that it's bad, but I have to come with a scientific rationale of how and why and in what extent and all that. All I can tell you is that we know that GMO manipulated food can interrupt the genetic expression of the genes, just like I told you, because you're exposing yourself to the non-familiar form of the food to your body. But to what extent, for example, if I put somebody in a GMO food, the real study that has to be done to prove that the GMO food causes cancer has to be like this. You have twins, identical twins, just like I showed you. Identical twins, so two sisters, for example, right? One, you put them on the GMO food, and then one on the non-GMO food. You can do that in a large group of people. And then if the people who had GMO manipulated food get more cancer, then you can say, yes, epidemiologically, this is proven to be the fact. My prediction is that not one factor can cause cancer. So if you eat GMO food, but you do something else right, you still don't get cancer. But if you do everything wrong, then you get cancer.
My name's John. My question is, for people that are adopted that don't have a family history, how much would you encourage them to start digging?
To start?
Digging for family history. For a person that's adopted has no family medical history whatsoever.
Right. And that's also a valid question, because our environment is so bad that I see, unfortunately, kids that they are very young and they've never had anybody in the family that had cancer. So our concept of cancer is a genetic disease is not. So it has to be, you always have some vulnerability genetically. But the fact is that because the environment is so bad that you don't necessarily have to have somebody in the family, that most of our grandparents, they died, and back then we didn't know why. I mean, they died and the doctors did not find any reason, or they called it a heart attack or whatever, but they had cancer. The reality is that every 30 seconds somebody dies of cancer in this country, and you can't really find out who in the family really had cancer. But it's always good, because at the end of the day, we're all at risk, regardless of our family history and whatnot, because of the bad environment that our parents or us were exposed to. We all have to start preventing it. And definitely, this is what I do. If somebody has or does not have history of cancer, they have to be screened. And the screening means that we have to look at the genes. The screening is not waiting until you get a cancer and then we do a mammography. 5 years later, we find the cancer. It's too late. So screening genomically is something that we can do. And we can do it on the kids and find out what's their risk 20 years from now, or 40 years.
Do you treat autoimmune disorders? And if not,
I'm sorry?
Do you treat autoimmune disorders?
Immune disorders.
Autoimmune.
Autoimmune disorders. I used to treat everything back then when I was just doing internal medicine, autoimmune disorders as well. And I use natural products very successfully for them. Everything obviously is intravenously in my practice, but not anymore. I just see cancer patients nowadays.
Referral for someone that would
I
use
do,
your approach?
yes. I think I'm going to take 2 more questions.
2 more questions?
Yeah.
You good for that? Okay.
Yeah.
I realize there's so many
Now
people.
everybody has a question. 9:30, I have to go.
Who are you pointing to? Marcia, okay. Excuse me, sir.
Hi, Dr. Nezami. I'm Marcia. I have a friend who has a brother who last year had throat cancer. You know, so he's a pastor, had been a pastor. He prayed, miraculously healed. Now this year it's back. I don't think he had any treatments last year, just a miraculous healing. So now he's at the point where he was on liquid feeding, and now he has sores in his mouth, so he can't consume anything. Now he's considering going to his doctor and having a feeding tube under his stomach. You know, he's weak, he's up in Van Nuys. What do you suggest for someone in that situation?
Well, I have to specifically see the case and examine the patient and see the medical records and all that. But what you described is something that we always see. Patients don't come to see me when they have to come when they're healthy. They have to come when they're healthy. They have to come when they don't have cancer and prevent it. When they're diagnosed, they have to come. They don't. They exhaust everything, and then after everything has failed, then they start to look for outside the box. And that's sad, because most of my patients, they have a stage 4 disease. 90% of my patients have a stage 4 disease. Some patients that I see, they come there as the last resort when they're dying in their hospice. And so, but I learned from one of my patients a long time ago. He had colon cancer. It was metastasized to his lungs and everywhere. And when I looked at the chest x-ray, it was like, have you looked at the window in the winter night, at the night? It's dark, but it's snowing. And you see it's night, but it's like it's full of this snow that makes it bright. When I looked at his lungs, it was like a snowing. Everywhere was tumor. And I said to myself, what should I tell them, right? This is like 7 years ago. And I called him in and I said, I want to show you your x-ray. And he looked at it and I said, maybe we should think about the treatment before we started. And his wife told me something. Everything I know and everything I do, and my patients taught me. And this was part of it. And my patient's wife told me, doctor, as long as there is breath, there is life. And I said, she's right. So I started him on the treatment, and he beautifully responded to the treatment. So I never say no to a patient, even if they're in the hospice, because I've seen miracles. Okay, thank you everybody, appreciate it. Yeah, call my office if you guys have questions. Look at the website, call the office. I will be happy to set up consultations.
When I first met this gentleman and I started on treatment, I told him, I said, Dr. Nezami, there's going to be a time where you and I are going to be standing together and you're going to be talking about your treatment. And I'm going to be able to stand here and say that you were able to cure me.
I should rephrase this because just like I said, I'm not the one. So I used my knowledge, but that's not mine.
I love that. This is amazing. Whoever did this job. Is that me? No. The next one is me, probably. The helicopter guy. Right.
And over here we have the life hub, which is on Vivo, which is 60% effective in reversing.
Right.
That's the first one. And then there's the second one.
Oh my God! Look at these folks in the boat. Wow! Wow!
There's no propulsion on the boat. There's no oar. There's no rudder.
Right.
There's no,
Just kidding.
climb in the boat. Go nowhere soon.
My God, this is amazing.
You know what? Just one.
Oh my God! Oh my God! Oh my God! Oh my God! This is amazing! This guy is a professional. Wow! Are you sure you don't need like a light on my head? This is amazing. I love it. Absolutely. Yeah, the rescue. Beautiful. Yeah. I'm Dr. Nezami, offering to take it safely from your home.